Hello, my name is Chris, and I would like to present to you my PowerPoint presentation about my plan to educate my stakeholders about my evidence-based practice project. So, as for any evidence-based practice project, we need to have a PICO question. For my, it is in adult neuro ICU patients, how does having a standardized bathing protocol with chlorhexidine gluconate compared to current ICU bathing practices with soap and water affect the overall central venous catheter associated bloodstream infection over a 3-month period? So, the theoretical foundation for my project is from Dr. Joseph Lister. He was born in 1827 and passed away in 1912. He is known as the father of germ theory. He's from England and he was a surgeon at the time, the primitive days of surgery. At the times, he observed that patients who had post amputation surgery will face a 40 to 50% mortality rate. Um, and he would think, what could cause that? And at the time, they believed it would be bad air that get into the wound, and that's what caused infection. However, Joseph believed that by increased hygienic techniques, such as wearing clean gown with each operation, as well as clean the patient's skin as well as wound with carbolic acid would increase, would actually decrease the mortality rate to 15%. So he believed that bacteria or microorganisms on the patient's skin is actually what caused the higher death rate. According to the Institution for Health Improvement, or the IHI, which is part of the CDC, Center for Disease Control, in 2008, they proposed a centralized bundle of care. In this bundle of care for patients with central lines include one, hand hygiene, two, maximal barrier precautions, which means that during insertion of central line, make sure that the field is sterile, as well as applying biopatch over the central line and protect it with a dressing, a tegaderm. Third is optimal catheter site selection, basically to avoid using the femoral line, the femoral site, because it's the groin area that actually harbors a lot of bacteria. So instead, we'll use the subclavian vein or the internal jugular vein. Fourth is to daily review of necessity of central lines and a prompt removal of unnecessary lines. Let's just say the patient's discharged from the ICU to a regular floor, the medical surgical floor. He or she might not need a central line anymore. Then we'll remove that to prevent any kind of complication that is associated with having it. And number five, I bolded and italicized it because at Banner Good Sam Medical Center, we already have the first four implemented, but number five, which is to bathe, which is to use chlorhexidine gluconate skin antisepsis. Um, Many hospitals in the state of Arizona have already used this to bathe patients with central line, but we as a hospital, we have not done it. So this is one of the reasons for why I would like to propose this evidence-based practice project. For my evidence-based practice project, I have identified the following stakeholders. The first group is the patients. The second group is the nursing staff. This includes registered nurses, and nursing assistants. And third is my clinical manager. Now let's talk about the first group, my stakeholders. They're my patients. So patients' role in this project is they function as a population for the evidence-based practice project. Therefore, their educational needs, including the benefits of having the CHG or chlorhexidine gluconate bath when you have a central line, as well as to educate these patients about the potential side effects of CHG, such as rashes, hypersensitivity, skin irritation. So they be able to report back to the nurse or the nursing assistant if any of these occurs. So the third stakeholder group of my project is registered nurses and nursing assistants. Their role is to implement the project as well as provide feedback to me. Because of that, their educational needs, I would say, are to, to tell them about the implication for this project, and also very importantly, how to do it and document it effectively and accurately. And the third stakeholder group would be my clinical manager. Her role in the study would be to provide collaboration in the development of a CHG bath protocol, as well as being my advisor. She's been in nursing for a long time, and she also has a master's degree, and she has assisted with many evidence-based practice projects that was implemented in our hospital. So having her, one of my stakeholders, that would actually help me. So I believe that her educational needs is I would tell her the implication for my evidence-based practice project as well as the benefits that it will bring to not only the unit but essentially the entire hospital. So the plan for intervention delivery of my project will be to tell my stakeholders about the following three things. First is the value of the project. This includes the benefits of the project and the cost of central line associated bloodstream infection, as according to Shannon et al. Each central line infection case would cost $64,894. Not only the cost of the this infection is high, but as well as the emotional suffering, the physical suffering, the loss of leisure time for both patient and family member. Those are just unmeasurable. So therefore, by having this knowledge, that would actually help my stakeholder to understand how much benefits that the success of this evidence-based practice project would bring. The second thing I would do for my stakeholder is to inform them about the progress of my project, to make them aware where we are as far as the infections rate goes, the compliance rate, supplies issues or anything like that. So I believe this would be something that would tell to my clinical manager and the nursing staff. Not necessarily the patient unless they are fully aware, such as if they're not intubated, if they not having any alter level consciousness. So I think this would be more appropriate for the clinical manager and the nursing staff. So the third thing is I would also gonna tell my stakeholders how they are gonna be able to help me out with the project. For the patients, I would tell them to report to me if they have any problems with skin irritation or hypersensitivity to CHG, also to voice their concerns. If they have any questions, I would answer them. And again, these project it's applying to ICU patients, and majority of them are acutely sick and also intubated. So for my nursing staff, registered nurses and nursing assistants, I would tell them to increase adherence to the proposed protocol, um, to report any problems that they encounter during the implementation of the project, and as well to voice any concerns, any question that they might have that arise during the project, that something that they think that they need more clarification on. For my clinical manager, I could have her to help me with reporting the infections rates for our unit, um, as well as to help me purchase supplies. Um, and to wrap it all up, thank you so much for spending your time to listen to my PowerPoint presentation about stakeholder education plan. I'm very excited about the next part of my project. So thank you.